Hi, my name is Nicole Ani, and I'll be doing my neurological exam. However, there's a lot more to a neurological exam than just really asking questions and also doing the physical exam. There's a lot of nonverbal aspects of the neuro exam. Therefore, during the exam, I'll observe the patient for the ability to wait patiently and see if their posture is relaxed, slumped, or still. I'll watch that their appearance is clean, it's age appropriate, and weather appropriate. Signs of restlessness, tenseness, and pacing can be abnormal. However, patients with Parkinson's disease or cerebral palsy may display these signs. Also, poor personal hygiene can also indicate depression, schizophrenia, or dementia. I'll also observe the patient for appropriateness of variations in and symmetry of facial expressions. I'll observe the patient interaction with me, and I'll be paying particular attention to both verbal and nonverbal behaviors. I'll note if the patient affect appears labile, blunt, or flat, and I'll also observe for any extreme emotional responses during the interview. Extreme, inappropriate, or unchanging facial expressions or asymmetrical facial movements are abnormal and may demonstrate anxiety, depression, or Parkinson's disease. They may also indicate a lesion in the facial nerves. I'll also note voice quality, which includes voice volume and pitch. I will assess articulation, fluency, and rate of speech by engaging the patient in normal conversation. I'll observe the patient's eyes when entering the room. I'll note whether the patient's eyes are open or whether they are open when I enter the room, and note the patient's response to any general environmental stimuli, such as noises or lights. I'll determine if the patient is alert, if the patient is awake with verbal stimuli, if the patient is awake with painful stimuli, or if the patient is just unresponsive. With the patient, when the patient walks in the room, I'll ask a few questions and then assess orientation by asking questions related to person, place, and time. I'll also be doing a mental Glasgow Coma scale. The GCS assesses 3 parameters of consciousness, such as eye opening, verbal response, and motor response. I hope you enjoy the rest of my assessment. Have a good day.